name's Karen. I'm a registered respiratory therapist with Family First Medical, and I've worked for the company for close to 20 years now. Today, I'd like to take a moment just to show you how to transition from your oxygen concentrator to your emergency backup cylinder. First, we'll start with troubleshooting your concentrator. When the concentrator is working normally, you'll see a green light located on the front of the unit. If there's a problem with your unit, then you'll have either a yellow light or a red light and an audible alarm. When you're troubleshooting the concentrator, the first thing that we need to do is decide whether or not it's the machine that's causing the problem or if it's the plastic supplies. We're going to start at the wall outlet and trace our way from the wall all the way to the oxygen patient. So let's start at the wall. First, we're going to make sure that the concentrator is plugged into the outlet. We next then want to come to the unit and make sure that the unit's turned on. Third, we'll want to check that the flow is set to your prescribed flow rate. In this case, it's at 3 liters per minute. Once we've checked the concentrator and determined there's no problems, we then want to start checking the plastic supplies. We're going to start again at the machine and work our way to the patient. First, let's check to make sure that it's connected to the unit. Once we know it's secure, we're going to trace our way along the entire length of tubing. When you're pulling the tubing through your hand, simply look for kinks or cloudy areas in the tubing. Maybe it's caught under a door casing or in your lift chair. And again, we're just going to continue until we come to the connection. When we get to the connection, we want to make sure that that is also secure. Once we've checked the connection, we're going to continue along the length of the tubing until we come to the nasal cannula. When you get to the nasal cannula, we're going to take a glass of water and simply check to make sure that the flow is coming through the concentrator. Dip the nasals into the glass of water. When the concentrator is functioning normally, you'll have bubbles in the glass of water like we do today. If there's no bubbles in the glass of water, then we're going to trace our way back to the machine. When we come to the connection, we're going to pull it apart and place the tubing in the water. If there's bubbles from the tubing, but not from the nasals, then we know that's the problem. For our video today, we're simply going to pretend that the concentrator's not working right. In this case, there'd be an audible alarm. Once you've determined there's a problem with the concentrator, we'll want to change the patient to their emergency backup tank. To do that, the steps are quite simple. First, we're going to open the cylinder. Simply turn the knob on the top with a few turns of your hand, counterclockwise. When the cylinder is open, the needle will show how much is in the tank. Remember, 2,000 is a full tank of oxygen. Once we've determined the quantity of oxygen in the cylinder, we simply want to turn the regulator to the patient's prescribed flow. Again, in this case, 3 liters per minute. We'll disconnect the tubing from the concentrator and we'll plug it in to the emergency backup. The patient can now place the nasals on and continue. Once you've connected to the emergency backup tank, you need to notify Family First Medical as to the nature of your problem, whether that's a machine failure or power outage. In the event of a power outage, we'd also ask that you contact your power supplier to try to determine how long your power will be out. We ask when you call us that you provide us with the duration of the power outage, as well as how much oxygen is in your cylinder. Remember, call day or night. It's really important for us to know that you're on your backup. It helps us triage where we need to go in the event of a widespread power outage. When the power comes back on, we'll show you what to do to turn your oxygen cylinder off. We're going to do steps in the same order that we did when we turned the unit on. Start with the cylinder and close the cylinder valve. So we're going to turn it clockwise until it's tight. You then want to watch the needle until it falls to the red section. Once it's hit the red section, we're then going to turn the flow back to off or 0. You can disconnect your tubing and reconnect to your oxygen concentrator. When you call us to let us know that your power's out, we'll give you instructions on how you should proceed. It may simply be to call us back in a couple of hours or when the tank becomes half full. We'll let you know what to do.